And my name is Samantha Loi, and I've worked in the Huntington space for a very, very long time, since 2011, initially as a research assistant in some of the longitudinal international Huntington's trials. But more recently, since 2015, I've been working as a clinical neuropsychiatrist at the Neuropsychiatry Centre at the Royal Melbourne Hospital, where we diagnose, assess and manage people with Huntington's disease. And on my other hat, I'm a researcher. I'm an associate professor and deputy head of the Department of Psychiatry, University of Melbourne. We wouldn't be able to do clinical trials without the participation of our community members. So we are very grateful and thankful for people who participate. And also if people have ideas, and really the work which I'm doing and many of the researchers we are doing is driven by the issues and the problems, I guess, which we are seeing that people with Huntington's disease and their families are experiencing. If I want to talk about clinical trials, I'll probably divide them up in two main different types. The first type really relates to, I guess, symptom management or changing, I guess, the pathway for Huntington's disease. So these are the drug trials I'm referring to. And these are looking at specifically looking at changing the Huntington or the protein in the brain, which affects Huntington's disease, and hence improving or halting the progression of their cognitive changes, their movement disorder, and some of the behavioural problems that we see with HD. The other type of clinical trials relates to a very broad range of treatments and quality of life and symptomatic options. And these really relate to novel things such as how can, say music therapy or dance therapy, how can that improve people's movements? Can speech therapy or different speech novel options improve people's communication skills? There are a whole lot of other types of clinical trials which might include imaging, for example. So people might have scans over a period of time to really understand what's going on with the brain and the brain changes as Huntington's disease progress. And sometimes what people do is they like to compare that to people who don't carry the gene or people who do carry the gene who are at a different stage. So then you can compare people, very, very broadly where they are along the journey. So it's a really important aspect in trying to better understand what's actually happening for people with Huntington's disease, how do the symptoms change, and then what things can be done as in interventions in terms of improving quality of life and care, as well as how can we halt the disease progression. So it's a really important area, and I think we've made some great advances in the field. And I can talk about that a bit later, but some of the antisense oligonucleotide trials, the clinical trials, have been really important in trying to look at the changing the progression of people with HD. So really important that people are involved. Inclusion and exclusion criteria are very important for different types of clinical trials, and it really helps the researchers try to work out what their treatment is targeting for what particular type of person and what stage of the disease that they are at. And so, for example, if I think about these medication trials, some of these trials are really looking at people at the very, very early stages of Huntington's disease. So they want to, I guess, capture them at a very early stage and see whether the drug can then change the progression or slow down or even halt the progression of their symptoms. And hence they really want to target people who are the very, very early stages. They don't want to, for example, include people who are at a different stage or a later stage because they know, for example, that the drug is less effective for people at that different stage. So they really want to make sure that they have what we call a bit of a homogeneous population for different trials. So that's quite specific for medication or drug trials, for example. But other trials will have different types of inclusion and exclusion criteria. I did mention the drug trials. Some of the drug trials, as well as looking at the stage of the disease, you have to be very careful if people are on different medications or have different other medical issues, because sometimes those medical issues can then affect what the drug might have on the person with HD. And so, for example, if a drug is known to affect somebody's heart, investigators don't really want to involve someone with a particular heart problem because it's dangerous, and they don't want to cause harm to the person with their heart problem. And similarly, for example, if they're on a particular medication, a lot of the drug trials say, often they say you can't have a psychiatric diagnosis, or you need to be stable. For example, you need to be stable on an antidepressant or have stable depression for at least 3 months, because they know that if you are changing an antidepressant dose, for example, that could also interact or affect the drug, and then the drug may not have the desired effect on the person who's taking it. And so there's a reason why I guess they want to have as clean as a population as possible for people in these trials. Other trials might have a little bit of different criteria. So a lot of the carer or quality of life trials, which I like to be involved with, they might say the person needs to have a carer, and that carer needs to be involved to help the person along with the intervention. And so if you don't have the carer might be there to help prompt particular interventions, different activities. For example, those types of things are linked in with the person with HD, for example. So you really want to make sure you have a very clean population. And then if a trial works, or people are, say, for example, improved in their depression, you can say, well, it works for this group of people. Now, I'm going to take a step back, and we know that in real life that people aren't clean. For example, we know that people are taking medications. We know that people may have, varying levels of depression. So they might take a medication, they might need it to be changed. So we know that in real life, that is not always what's happening. People are, have a variety of different comorbidities and partners. But I think from a clinical trial perspective, they want to target as, a clean population as possible, so then they know that the drug works or the intervention works or not. And then if it works, then they can think about, can we extend this intervention or treatment onto a different population? And I know it can be very disappointing. You get told that you have a trial and there's treatments available, you get told you can't go in it. I think it's quite difficult. Some of the clinical trials, you had to have particular genetic, they called them SNPs, for example. You had to have a SNP1 or a SNP2 or a SNP3. And different people have these SNPs. If you didn't have the SNPs, well, you couldn't go into the trial. And it's because the drug targeted, for example, that particular SNP, which the person had to have. If you didn't have the SNP, you couldn't go into the trial, because it wouldn't be clear if it worked because you didn't have the SNP or the drug, for example. So it's worth exploring these with your clinician and thinking about what else is out there if you can't go into that particular trial. As a doctor, I would be recommending different types of trials to people, and it can be quite daunting thinking about, well, I'm going to come to a centre, it's, I'm going to have to travel and whatnot. So I think some of the things people can ask their doctor or the clinical trial people if they're interested, there's a couple of practical things, for example. So if you are living in an area which is very far away from a clinical centre, and if you have to go there every week or even every 2 weeks, you might think, well, this is actually going to be difficult for me. And if, for example, you're not driving or you need to rely on your spouse to take you, you might think this is very annoying. I don't want to have to go 2 hours every week. However, if, for example, the trial offers transportation, or they might offer you vouchers. So it's about finding out what's in it for you. So, for example, is it going to be inconvenient? Will you get put up in a nice place or get transportation? What are the benefits of being in a trial? So, for example, one of the good things about being in trials is some of these things aren't offered as part of normal clinical care. So there are some really good music therapy or different types of speech therapy trials, which are only set up for clinical trials because there's money for these things set up. They're not part of your general clinical service, or they cost a lot of money. So if people are interested in helping their communication or language, there might be a clinical trial specifically for that, which they may not be able to otherwise access because it costs too much money. And so being in a clinical trial for that purpose might be really useful and of benefit for the person. And so those things might be considerations to participate. You can get information back. I think knowing about what's in it for you and what can you benefit is really important. And thinking about how people can further the sort of research in the field. I think those aspects are, reasons to get involved in clinical trials. And I think the other thing is you get to meet a very wide range of people who you might not otherwise meet. So often they might be researchers, they might be quite different from the doctors who you see from day to day. Your GP might be researchers doing all these other really interesting things. And I think that often can spark people's interests further in other types of trials and activities in Huntington's. I think it's a really exciting space at the moment. But considering when I used to tell people that they were gene positive, when I tell people, I can now say things like, there is a lot happening, there is a lot out there. Actually, in fact, where I work, there are loads of clinical trials happening. In terms of the drug trials, we've got drug trials at different phases. When people talk about drug trials, they talk about phase 1, phase 2, etc. And that means they're at different stages of development and trying to find out how they're working and if they're safe, for example. So some trials, like phase 1 trials, anyone can be on them regardless of where you're at. And it's about making sure that people don't get really sick. But that's really important information. And so I can tell people, not only are there drug trials available and that there is actually real hope for the future, for you, maybe your children, that there is hope for cures even. There are a myriad of other trials. Huntington's is really encompasses a very wide range of people and diseases and symptoms. So there's many things out there. There's lots of different therapies and speech and language and music, but then there's things like imaging, learning about apathy, for example, different symptoms. What's the difference between depression in Huntington's disease compared to depression in not Huntington's disease? So I think there's many things out there, and Huntington's disease is so unique because of the gene that we actually know what we're looking at to start off with. So there's lots of things, lots of exciting times, I reckon. So obviously websites such as yours, Huntington's Victoria, can have those types of information. Asking your doctor, who often would know what's going on in the space. There are a few other websites. So I know, for example, in Victoria, there's what they call the Huntington's Disease Network, or HDNA. That's a large network or website which has a lot of information, including clinical trials. So it's worth looking there. But I think there's nothing wrong with just putting into Google, into your search term, Huntington's trials. You will get drug trials, but I also want to emphasize drug trials are not the only clinical trials out there. And you'll get a raft of different types of things out there. And it's definitely worth asking your doctor.